Hello students, today we'll be dealing with some of the instruments. So we are going to study regarding the instruments. So first of all, I'll be dealing with the instruments which are used for the gynecological and obstetrical examinations. So we'll see what are those instruments used for the examination one by one. Okay, first we'll see regarding this instrument. I hope all of you have seen this instrument. This instrument is called as a Sims double bladed posterior vaginal wall speculum. Even though it is mentioned as posterior vaginal wall speculum, you can use both on the lateral aspect as well as in the you can retract the anterior vaginal wall also. So this is called as a Sims double bladed posterior vaginal wall speculum. Okay, so this is simply called as a Sims speculum. We can just call it as a Sims speculum. If you are working in the labor room or in the operation theatre, you might have seen this Sims speculum. So this Sims speculum comes in a different size. It has got a shaft and it has got a two blades. So these two blades, it comes of different size, and in the middle you have got this portion is called as a shaft. So this is used to introduce into the vagina, and it is called as a posterior vaginal wall retract. So you are introducing and then you are retracting the posterior vaginal wall. Not only the posterior vaginal wall, you can also retract the lateral vaginal wall as well as the anterior vaginal wall. So this is used as a retraction of the to weave the part, that is the vagina, as well as you can see the inner part or like cervix and the uterus. So this instrument is used not only for the examination, it also used for the operations also. And in the shaft you can see a groove. There is a groove in the shaft. This groove helps when you are doing certain operation, just to flow of blood or any particle is collected through this groove. And also you can collect the specimen also using this speculum. The blades are at the angle to the shaft. You can see they're just right like angle like 90-degree angle. You can see just somewhat like 90 degrees. So it is angle to the shaft, and you can see that the both blades are pointing on towards the same side. So this is the features you can see in a Sims speculum. Next we'll see the technique, how you are going to introduce this speculum. So the speculum is introduced in an anterior posterior direction, that is the anterior posterior of the introitus slit. So you are introducing in this fashion, that is anterior posterior diameter, and then you are rotating to a 90-degree angle and you are holding the speculum in this way, in this fashion. And you have to see that the 2/3 of the speculum or the blade of the speculum has entered into the vagina, so that you can have a good view of the whatever you want to visualize. So this is how you are going to introduce, or the technique of introducing the Sims speculum. Next we'll see the uses of the Sims speculum. So it is used for retracting the vaginal wall. So we'll see what are the uses of it when you are going to use the Sims speculum. So it is used in all gynecological and obstetric examination, and it is used in the operation of the perineum, that is in the 3rd-degree perineal tear. And next we can it can be used in the operations on the vagina, vaginal examination you can use, vaginal hysterectomy also, Fothergill's repair. The Fothergill's repair is the operation which is done for the uterine support when there is a uterine prolapse, and VVF repair and collection of the urine for culture in VVF case. Caldosynthesis, that is the extraction. What do you mean by caldosynthesis? Is it is an extraction of the fluid from the pouch of Douglas, and vaginal cytology. Operation on the cervix, that is you are using for stretching of the cervical tears, for for cervical biopsies and cytology. Conization of the cervix, application of McDonald stitches and Schrodker's operation for cervical incompetence, dilatation of the cervix, and for inserting the cerviprim gel. Next you are using for the operation on the uterus. So operation on the uterus, that is dilatation and curettage you are using, medical termination of the pregnancy, endometrial biopsy, and the investigation, the test like hysterosalpingography and tubal insufflation. Hysterosalpingography and tubal insufflation, it is used to find the patency of the tube, that is the fallopian tube. And for IUCD insertion, follow up and removal, for all these things you are making use of sim speculum. While inserting IUCD, you need a sim speculum. During the follow up also, to see the position of the thread, you are using a sim speculum. And also during the removal of the IUCD, the sim speculum is very essential. So for all this IUCD insertion, if you are having a IUCD, a separate set, you can see a different size of sim speculum inside this. And for the packing for PPH, that is postpartum hemorrhage, you are using this sim speculum. Finally, we'll see what are the advantages and what are the disadvantages of this sim speculum. The advantage of the sim speculum is it gives a better field of weave compared to the other speculum than self-retaining speculum. So instead of that, self-retaining is a cuscus speculum. Instead of that, sim speculum gives a better field of weave. And what is the main disadvantage in sim speculum is, here you need an assistant. An assistant is needed by a surgeon to hold the speculum during the operation. So that is one of the main disadvantage compared to the retaining speculum. In cuscus speculum, you can just introduce and hold it in place, whereas here in sim speculum, you want someone to hold the speculum. So that is the main disadvantage of sim speculum. So today we have seen about the SIMS double-bladed posterior vaginal wall speculum. So this is the speculum which is available in the different sizes. So today we have seen why it is used, the features of the SIMS speculum, as well as the uses, the advantage and the disadvantage of the speculum. Hope you have understood this. Thank you.